Hi, I'm Dr. Luke Van Kirk with Command Family Medicine, direct primary care practice here in Springfield, Missouri. And I did my family medicine training at Cox Family Medicine residency and graduated in June 2015. So I've been in practice almost 3 years now in private practice. One big reason why I take students is because I want to expose them to the private practice side. Just today's day and age, most physicians are hospital employed. I want them to see some of the business aspects of owning your own practice and what that looks like, and just getting them to realize the other options out there besides being employed by a hospital, and the possibilities that you can implement with having your own practice and not having to worry about administrators and what. With being a private cash-only practice, we run pretty minimal as far as with staff, so we have one part-time, one full-time nurse, and so having the students kind of as almost an extra staff member while they're here, just to kind of get them trained with some of the things that help around the clinic. They help us with dispensing medications out of our own pharmacy, and we can help them with learning phlebotomy if they haven't done phlebotomy before, or if they're trained in it, then they can act as a scribe for me. They help to type my notes, and then also it's a good teaching tool because once they type my notes, I can go over the notes with them and help give them pointers on how to better organize their notes and what details need to be including in their notes. And then also, I really enjoy taking students because with my style of practice, I have a lot more time with my patients and with the students, and so when we have interesting cases that come up, I have a fair amount of time to discuss the cases with them, and we'll go over the workup with them and kind of help guide them on how I do my research and how I look up things that I'm unfamiliar with, and just help ingrain that process for them. So for my staff, kind of what I was explaining with training the students somewhat, it's able to take a little bit of pressure off of my staff when they're able to help with getting medications ready for patients or helping draw labs. Even occasionally, sometimes we'll have them answer the phones depending on what's going on. And so it can, when we have good quality students, I can help offload some of the pressure that my staff feels. I'll ask them questions when it comes up with cases of things that, maybe depending on their level, whether they're the third or fourth year, things that they should know, and try to figure out where they're at knowledge-wise, and then figure out the different gaps that I need to help fill in along the way.